Radius. Introduction. The radius is the lateral bone of the forearm. Side determination. Upper end has disc-shaped head. Lower end is expanded. Lower end. Anterior surface. Thick prominent ridge. Posterior surface. For grooves for extensor tendon. Sharpest border of shaft. Medial border. Features. Upper end. Head.
Disc-shapat.
Covered with hyaline superior concave surface that articulates with capitulum of the humerus to form elbow joint. Circumference. Articulates with radial notch of ulna to form superior radio-ulnar joint. Neck. Enclosed with annular ligament. Radial tuberosity. Located on medial part of neck, it has rough posterior surface and smooth anterior surface. Shaft. Borders. Anterior border. From radial tuberosity to styloid. Process. Upper half. Oblique anterior oblique line. Lower half. Vertical. Posterior border. Similar to anterior border. Upper half. Posterior oblique line. Medial border. Sharpest border. From radial tuberosity to ulnar notch. Surfaces.
Anterior.
Surface. Lies between the anterior and interosseous border. Posterior surface. Lies between posterior and interosseous border. Lateral surface. Lies between anterior and posterior border. Lower end. It has 5 surfaces. Anterior surface. Thick. Prominent ridge. Radial artery is palpated here. Posterior surface. For grooves for extensor tendons. Medial surface. Occupied by ulnar notch for head of ulna. Lateral surface forms styloid process. Inferior surface has triangular surface for scaphoid bone and quadrangular surface for lunate bone. Attachments. Origin. Flexor digitorum superficialis. Flexor pollicis longus. Abductor pollicis longus. Extensor pollicis brevis. Insertion. Biceps brachii. Supinator. Pronator teres. Brachioradialis. Pronator quadratuas. Ligament. Quadrate ligament. Oblique cord. Extensor retinaculum.
Articular disc.
Clinical anatomy. Cole's fracture. The radius commonly gets fractured about 2 centimeters above its lower end. Smith's fracture. If the distal fragment gets displaced anteriorly.